North Highland is thrilled to be part of the TAG community and the Excalibur events. North Highland is a management and technology consulting firm with around 750 professionals. We approach consulting slightly different in 3 different ways. One is we only hire experienced resources. Our average professional has about 15 years experience. 2 is we work and live where our clients do. This allows us to be part of the community, like TAG, as well as have a life balance where we can be at home with our kids, soccer practice, etc. We consider it a win-win for everyone. And lastly is we guarantee our work. This is really quite simple, but rare. Given our experience as well as our employee-owned company, we can stand behind our work. Again, North Highland is thrilled to be part of the Excalibur events and salute all the winners.
You may be shocked, but we fundamentally believe that a huge part of the efficiency in healthcare is based on the fact that we are providing healthcare as a paper-based system. So people don't have the right and appropriate access to information when they make treatment decisions, and in aggregate, we have very little knowledge about the most important system in the country. So we fundamentally believe that technology will play a real critical role in changing the whole provision of healthcare in this country. You know, we do a lot at McKesson, and so what I try to do is have one simple slide that I can talk to every employee about what we do and the impact that we're trying to make. And this is it. I call it our healthcare leadership slide. What we want to do is we want to get rid of the paper in healthcare, and we want to put the healthcare team online. We want to connect that team. We want it to be patient-focused. We want it to include hospital stays and interactions that you have in the hospital environment. We want it to include the activity in the physician office. We want to understand the impact and the cost of care and the interaction with the payer. And we want you to be hooked up to the pharmacy that's providing the medications that are an essential part of care. Now here's the big inhibitor. Most of these places are still paper-based. So what are we going to do? I think what we're really talking about doing is changing the way care is provided and changing the way care is provided at the point of care. And it's really starting to happen, and as I said earlier, my biggest concern from a healthcare perspective is that this economy and some of the political changes will just bring our progress to a screeching halt. Because if you have to pay for the nurse on the floor or the med admin system, you're going to make sure that you have the nurses you need to provide care first. And we simply can't let that happen. You know, every day, 2 million clinicians across this country use our software at the point of care in hospitals to improve patient care. But basic technology, I'll give you an example, barcode scanning at the bedside. Today we have barcode technology, kind of like Kroger, where you go through the line and you scan the patient and you scan the med and you scan the nurse and you make sure the appropriate med is going to the appropriate patient. It's a staggering statistic. Each week, that technology prevents 250,000 medication errors. 250,000 errors by that technology every single week. Now, what makes that number so staggering is across the United States, only 20% of hospitals scan at the bedside. Pretty amazing. I mean, imagine if we had 100% compliance to bedside scanning. Another technology, the physician portal. How many of you go to see a physician or go to visit a spouse or family member in the hospital and see the paper chart? Do you ever try to go through a paper chart to aggregate data? Some people say as much as 30% of tests in healthcare are done twice because the physicians making the treatment decisions don't have access to the information from the previous test. We have another product. It's a simple portal. It's available to the physician in the hospital, in their office, or at home, and it brings together that patient chart online. Almost 5 million times a month, physicians from across the country access that portal. Still, 25% of physicians in our country use that technology. And you know, there's a prediction that in the next 5 years, the amount of information available to a physician as you start looking at our genetic profile will increase 1,000-fold. So how can we be confident that a physician making decisions about our care can do all of those calculations in their head? I would say it's impossible. And without tools like physician order entry and very sophisticated clinical decision support tools, no one will have access to the best care. In our country, about 30% of the hospitals have begun implementing physician decision support and physician order entry at the bedside. So we clearly have a lot of work to do, but it's clearly really important that if we don't get going and we don't keep going, we will no longer be able to sustain the level of safe care that we all expect in the healthcare delivery process. Now, one of the other things I wanted to point out is for any of you who've automated a paper process, when you start digging into that paper process, you discover there are lots of extra steps and lots of rework along the way. We just had an engineering team look at the average hospital and go through the number of steps it takes from the time you leave or the patient is discharged till they get a bill. And again, it's a paper process, and we actually track the 52 steps that have to be taken before that bill can be dropped. And then we said, well, what impact can automation have? And we thought if we could bring this whole system online, instead of 52 steps, there would actually be 4 points that there would be a human being involved in the decision-making process before a bill was dropped. I don't know the last time you've been in a hospital, and probably very few of you have gone to the business office, but there are still hundreds of people who are following money and following collections in paper charts. And so what an incredible opportunity to totally change the collection process and to drive efficiency into cash and financial management in the hospital environment. So we have a lot of work to do, and I would submit to you that without technology, it doesn't matter what healthcare processes we put in place and how the government sets us up for healthcare reimbursement and pay. We need a system that is safer, we need a system that is more efficient, and we need to use technology to support the physicians and other caregivers that really are working every day to provide the best care. Now, I'm going to spend just a minute on physicians. Probably all have one. Go to their office. How many of you have a physician who's in the process of automating their office? Electronic medical record. It's the thing, right? You go in there, they complain about it, you know, they say, well, you know, why am I doing this? It takes me so much longer, I hate it. After they've been using it for a year, you may even get them to admit they couldn't live without it, but it is a huge process change. What we're starting to see is physicians implement technology because they recognize that they can't live and keep up in a paper world, and they also realize that the new doctors who are graduating from medical school have gone to school using technology, and guess what? They can't practice without it. I spend a lot of time at Duke. You'd be hard-pressed to find a physician graduating from the top medical schools in the country that could dose an IV without a computer. I mean, there are many kids today that can't spell. So you have physicians who are coming out from ED programs, from hospitalist programs, from intensivist programs, and they have grown up with a computer doing the calculations. So we're going to see a proliferation of EMRs, electronic medical records, in the physician office. But I think what's more exciting about that is how difficult is it to get to your physician today? Pretty challenging. I think once you automate a physician office, you open up the world to a different kind of care, a kind of care that's connected. Let me give you some examples. When you automate a physician office, a hospital can send results to that office online. So instead of waiting days or for a phone call, the results from your test can go immediately to the physician, and guess what? They can release those results to you online real time. Sounds like something simple, but in actuality, it is a paradigm shift in the way physicians communicate with their hospitals and the way physicians communicate with us, and it makes the system more efficient. Wouldn't it be nice when you went into a physician office to understand how much money you were going to pay and what your health plan reimbursed you for? Once you've automated a physician office, you can connect them to a payer. And once you've automated a physician office, when they enter a prescription order for you, they can actually enter that prescription online, look at drug allergies, look at redundant drugs, and electronically transmit that prescription to a local pharmacy. So when you show up to pick up the medication, it's there and it's ready for you. So as we automate hospitals and as we automate physicians' offices, we create a really dynamic opportunity to bring healthcare together, to connect healthcare, and to bring healthcare online. Now, to me, I think that brings us to the most exciting part of healthcare technology. What I say to our customers and what I say to our employees is, close your eyes and imagine, you pick the time. Is it 5 years from now, 10 years from now, 12 years from now? Healthcare is online. There's no more paper. How is the community better off? How are we better off as users of the healthcare system and people who are very cognizant of our own wellness? And to me, this is where the rubber hits the road and where technology has an impact, because when we automate healthcare, life in our communities should be simpler and it should be safer. Now, to put this in perspective, take your typical community. This is what the average community in the United States looks like. About 15% of the people who live in that community take up 80% of the healthcare cost. I'm not sure how many of you look at this within your own company, but within McKesson, the top 6% of our healthcare users spend 90% of our healthcare dollars, 6% of employees. So we have a portion of the population, whether it's chronic care or a significant issue, costs us a lot of money. 15% cost 80% of the dollars. There are another 35% of the community that require a sustained relationship with their provider. Maybe a woman who's pregnant, maybe somebody who has a baby in the first year of their life, maybe somebody with diabetes or asthma who has an ongoing relationship with their physician. But about 35% of the people in a community have regular interaction with their local healthcare system. And 40%, knock on wood, looks like me. When I'm sick, I want to get a doctor. I want to get them fast. I don't want to deal with the hassles. I don't want to wait for an appointment. When I have to get an annual exam, I want to be able to get that exam. And when I have a question, I want to be able to find my doc. So 40% of us are casual healthcare users, but guess what? We're getting more and more impatient, and we're getting more and more used to technology enabling better service. So that's how the community looks, okay? So when I look at our vision for the future, and when I look at the vision of the future for IT and healthcare, we talk about the fact that using technology, we should be able to impact the community and improve the health of the community. So I'm going to give you a couple examples. I'm going to start with the 15% that is very sick. Those 15% of patients end up in the ED. We did an analysis, and a third of those people who end up in the ED would not be there if they had someone to call, to ask a question to. I mean, think about it. So many people end up in the emergency room because there is no one to call if you can't afford a physician or if you're concerned, so you go to the emergency room for care. A third of the Medicare patients in this country are readmitted. They're discharged, and within 60 days of that discharge, they end up going back to the hospital. So what we've built is an electronic network, basically an Ask a Nurse by phone or by internet, a place to go when you have questions. We've also built a readmission support system, so when you get home, if you're online, we do it through the internet. If you're not, we do it through the phone. We can actually follow up. Did you take your meds? Did you go see the doctor? How do you feel? Do you have a fever? So all of these technologies made available to support the 15% of people using a great portion of the healthcare spend can be provided through the appropriate use of technology.